Hi there, welcome if you've just joined us for the very first Lunch Lab session. We're just waiting for people to join, so we'll just give people a couple of minutes to join us and then we'll kick off. Just give everyone a minute's grace before we start. Welcome to everybody. Great to have you with us. Just got a few more people joining, so I'm just buying ourselves a minute to get everybody settled. So this session is going to be recorded. So everything that you hear today, you'll be able to access again, and we will circulate that link to the membership. And this is the first of the Lunch Lab series. We'll be looking at all 7 of the diversity and wholesale pillars across the rest of the year in these snappy 1 minute, that would be very snappy, 1 hour Lunch Lab sessions. And we are starting off the series with Fitback, who are new members of FWD, and they specialise in providing physiotherapy and mental health support to a number of large wholesalers and retailers. You probably can see Jonathan and Claire on the call in the video icon at the top of your screen. This is Jonathan's business, so he is here just to say a hello and maybe a wave as he's muted. And Claire will be delivering this session. So I think we will make a start, and if people arrive a little late, they'll be able to have a copy of the recording anyway, so can refer back. So without further ado, I will hand over to Claire.
Thank you so much. Good afternoon, everyone, and thanks for joining. I hope you're all taking a little bit of time to grab maybe a drink and a bite to eat whilst attending today's session on mental health, especially given that we're a lunch lab. I'm Clare Price. I'm Head of Mental Health and Wellbeing for Resilient Minds, Fitback's new evidence-based mental health service. And Fitback are a physiotherapy company working with a broad range of customers, some of them FWD members. So shout out to anyone from Morrison's and Bidfood who are here today. We know that there's 1,000,001 things that can affect your mental health, and it can be a little bit like a jigsaw puzzle. But the relationship between our body and mind is unquestionable, which is why it makes sense to have a service which can support employees and individuals with both their physical and mental health. But today we're going to focus on mental health. Thought it'd be helpful just to give you a little bit of background about myself. So I'm a mental health nurse by background. I'm a CBT therapist, and I've been trained in some other therapy techniques as well. So rational emotive behaviour therapy and solution focused therapies alongside some others. I worked in the NHS for 19 years, and I was a university lecturer in CBT. And for the past 14 years, I've been working in private healthcare, designing and delivering mental health services for corporates such as BT, PepsiCo, utility companies, and then also insurers and statutory services like fire and police services. And I was delighted to be asked to deliver the session today. So what are we going to cover? I think it's really important that you get an understanding of the key facts and figures which underpins the cost of mental health in the workplace. And then we're going to do a little bit of reflection on why it's important to support mental health at work. And people will have very different levels of knowledge and understanding. So if I'm teaching you a little bit to suck eggs, then apologies for that, but it's always helpful to, reflect and review. And then we're going to think about the key pieces of legislation in the UK, so you know what your obligations are in relation to mental health, stress management, psychosocial risks in the workforce. We're going to consider the evidence base, including how we build mental health support that actually works, and how to focus in on those evidence-based services and interventions. And then to finish, I'm going to share some case studies to illustrate what can be achieved. And also we'll have a Q&A session. If you want to post any questions as we're going along, that would be brilliant. And then we can get to those towards the end of today's session. And so I hope that all makes sense. So thinking a little bit about what is it that means that mental health and wellbeing and work is so important, and companies really do have a moral and legal requirement to look after their employees' mental health and wellbeing. There's a financial, economic, and therefore a societal and human cost to poor mental health. Mind research says work is the biggest cause of stress in people's lives, even more so than money. And when you consider that we've been through considerable adversity with COVID and now a cost of living crisis, that's really saying something. So why would we consider mental health and wellbeing? And I think for me, it really is that it's the right thing to do. And that's at the core of every part of your duty of care towards your staff. So what are the key facts and figures? Did you know that the latest figures show that poor mental health costs employers between 33 billion and 42 billion? And that's in relation to sick leave, lost productivity due to illness, retraining needs, recruitment fees to replace an employees unable to work, time lost for replacing staff and training new employees, and also workplace adjustments that are required. And this amounts to a cost per employee of between 1,205 and 1,560 per year. And this figure is for all employees, not just those who are ill. So even if a wellbeing strategy can save your organisation a fraction of this amount, it's worth the cost. If we have 12 million workdays lost to stress, depression and anxiety, and 1 in 6 people experiencing mental health problems in the workplace, that stands to reason. If we have circa 60 people on this call, 10 of you will potentially be experiencing a mental health problem right now. So, it's critical that we think about how we manage organisations and employees to keep people psychologically well whilst they're at work. 10% to 15% of absence is caused by work. But then the rest of absence is often related to mental health difficulties, and then how they impact people within the workplace. So they might be external to work, but actually is impacting them in terms of how they manage their role, their responsibilities, and their duties of their job. And I think it's also important to say 80% of mental health conditions, and especially in the workplace, are going to be common mental health problems. And I don't know whether people understand what a common mental health problem is, but realistically, we're talking about depression, anxiety, and of those anxiety disorders, that would cover things like obsessive compulsive disorder, post-traumatic stress disorder, panic and social anxiety, health anxiety, and generalized anxiety. And I think that's often quite surprising to people, that things like obsessive compulsive disorder and post-traumatic stress disorder are considered a common mental health problem, but they are ultimately treatable, and actually often within quite a reasonable time frame and number of sessions. So thinking about why you might also want to think about mental health in the workplace, for every pound spent on mental health, interventions, we can reduce absence and presenteeism and staff turnover. There's a return on investment that's around £5, and that means that potentially businesses could save £8 billion a year if they're supporting mental health in the workplace. So there are other reasons. Not only is it the right thing to do, and it also makes financial sense, there are other reasons. So we think about the fact that if you look after and have a healthy and engaged workforce, this is the building blocks of organisational and financial success. And that often that sort of success comes as a byproduct of the well-being of your people rather than striving for that in the first instance. And we also know that mental health support in the workplace enhances performance productivity, it increases engagement and job satisfaction and loyalty. We improve sickness absence and presenteeism. We can boost recruitment and retention, and also it positively influences brand and reputation in a quite a agile sort of environment where people are choosing to move jobs much more frequently within, our younger populations, to hold on to people and to be a brand and have a reputation that means that people will consider you as an employer is really important. And I would say that, yes, mental health and wellbeing support requires a budget to be carved out, but long term, it saves money if you spend in the right places. And we'll look at what the evidence says shortly. But I thought first it'd be really helpful to really take a look at the legislation. So the key pieces of legislation that organisations need to be able to be aware of that helps them to operate within the law and stay on top of best practices and standards in the UK are these key acts. So the Health and Safety at Work Act 1974, Section 2 says you have a general duty of care to ensure the health and safety and welfare of all your employees, including mental health, and you need to protect employees from the risk of stress at work. The Management of Health and Safety at Work Regulation 1999 goes further and says all employers are required to make suitable and sufficient assessment of the risks to the health and safety of their employees and take adequate measures to reduce that stress. The health and safety regulations means following the law on working time regulations. So things like, working long hours without regular breaks, because that can be a cause of work-related stress. And then we also need to take into consideration the Equality Act 2010. This protects disabled people against discrimination in the workplace. And we need to think about what is disability classified as, and it's a physical or mental impairment which has a substantial and long-term effect on the ability to carry out normal daily activities. Now, people with mental health and mental illness may not think of themselves as disabled, but in the eyes of the law, it may be considered if their condition impacts their ability to do their job. So things like depression and anxiety, as I mentioned, PTSD, bipolar, schizophrenia, and in general terms, long term is really usually 12 months or a condition that maybe cycles and has been cycling for many years. And then the Mental Health Discrimination Act 2013, which was really around reducing the stigma and negative perceptions associated with mental illness. But actually, there were specific repeals and amendments for roles that previously people with mental health conditions could not take on. So pre-2013, MPs undertaking jury service and company directors could be terminated should they have a mental health problem, but we've removed those restrictions on people who have experienced mental health conditions in certain roles within society. So there's a duty of care to avoid psychological injury as much as a physical injury, and to provide a work environment that is, as far as reasonably practicable, free from psychological harm. So what we're going to think about is then, based on this legislation, what must you do, but then sort of consider what should you do and what could you do if the sky's the sort of limit. So I think we need to really think about the duty of care to avoid that psychological injury. And what that means you must do from the legislation is psychosocial risk assessments or stress risk assessments. And that's to carry out risk assessments to identify work activities that may cause stress-related ill health and take actions to control and mitigate any identified risks. And what do we mean by a psychosocial risk? The likelihood, what we mean is the likelihood and degree of harm that could occur as a result of an exposure to a hazard. And then you're going to ask me, well, what's a psychosocial hazard? So that's anything in the design or management of the work that increases the risk of work-related stress. But we do need to remember, not all stress is bad. Many positive stresses in life that motivate action and peak performance. And if anybody's seen the stress curve, and if you haven't, we can post it and a little bit later. We'll know that you can be at the one end of the stress curve, which is where you're unmotivated. The other end of the stress curve is really distress. And then in the middle is where we want people to be within that sort of stress where they're performing to their peak. But what do we mean by sort of psychological hazards then? I think it would be significant things such as occupational violence or things that are ongoing without respite. So sort of key examples there are around things like work overload, low job control, maybe poor supervisor support or lack of role clarity. And we can use the HSE stress standards to help us focus on those key areas of work design. And that gives a framework to sort of help you to think about what does a psychosocial risk assessment look like. And then you have the complicating factors of individual differences. So work preferences and frequency and duration of exposure. That means that not all hazards will contribute to developing psychological injury anyhow. So of course that brings you know, a degree of personalization, but well planned out risk assessments to address the likelihood and degree of harm that can occur if risk is not appropriately managed, where you can identify psychosocial hazards to specific groups, so the nature and type of work and design, illness, injury reports, and sort of thinking about how are you going to engage your workforce to help you to identify those psychosocial hazards. And then once you've sort of kind of understood what a psychosocial risk is and you've taken action to review that and assess the risks, you then need by law to have a review process, and that's undertaken when changes in workplace occur. So best practice is really a 6 to 12 month review process, but also if you get new staff, new job, new equipment, changes to any environments or processes, or if a worker spots a problem or there's any accident or near misses occur, then that should trigger a review of your processes. It's also important to think about a risk register, and this is where you document a record of the hazards identified, who might be harmed, and what actually is being done to control risks. And any business with 5 or more employees are required to have an up-to-date record of those hazards. And do be aware that for the psychosocial and mental health, this can be part of a much broader health and safety program or an occupational health program. And then also what you must do is have reasonable adjustments and access to reasonable adjustments for your workforce. It is a legal right for changes to be made by an employer to remove or reduce a disadvantage related to somebody's disability. So they're the 4 key things that the legislation says you must do to support and help manage your duty of care to avoid psychological injury of the workforce. But what does the evidence say? So the evidence would say that we need to try to embed the right practices and procedures. We want to provide good working conditions, and that's really the crux of the risk assessment. So the psychosocial or stress risk assessment really looks at where are the areas fundamentally as a cornerstone and as a primary intervention you can help your workplaces be less of a hazard to psychological health and well-being. And that helps promote healthy work-life and balance. So the evidence says focus on your culture and an evidence-based strategy. You need to avoid the tick box trap. And what do we mean by that? Well, we mean where you invest in mental health without considering what employees need or want and whether they work. So anything that you have implemented, there should be determinants of success and how you might measure the outcome of a program or a service that you implement. So thinking about whether they actually work. And many people look at an EAP service or mental health first aid, maybe mindfulness apps, etc., without understanding, are they really working? And often they're implemented in a reactive way due to something that's happened in a crisis rather than necessarily being proactive. I think we need to be really clear. It's more than a few subscriptions or office treats. The Mind Mental Health Index at Work 22-23 found that actually, in general, mental health in work has improved. So over 57% of people reported they'd communicated experience of poor mental health with their employer. 33.5% said they'd feel comfortable now talking about mental health with their employer, which was an increase of 5.5% on the previous year. And 47.5% who disclose felt supported, which is up 9.1%. So we're starting to see things move in a positive direction. However, you know, this mental health in the workplace has been you know, a focus for a considerable amount of time. So we need to think about best practice guidelines to make sure that you do get the best outcomes for your employees and their mental health. And there are a number of core best practice guidelines that aren't around legislation, but do help us to focus in on the things that are important in terms of mental health at work. So I mentioned previously the health and safety executive standards, and they have the stress standards, 6 domains, which are known to influence people's mental health in the workplace. We have NICE, and they have the healthy workplaces improving employee mental and physical health and well-being, but also mental well-being at work guidelines. The World Health Organization have guidelines on mental health at work. The DWP and Department of Health and Social Care, they commissioned the Thriving at Work Stevenson and Farmer report, 6 core standards for businesses to implement. And the World Health Organization have guidelines on mental health at work. And finally, from sort of core best practice guidelines, the OECD have a number of reports on workplace mental health in the UK and across OECD countries, including myths and realities of mental health at work, fitter minds, fitter jobs, and others. So I think, you know, there are core texts that you can look at and that we've drawn the evidence from today to say, okay, this is what the legislation says, but this is what the evidence says, and where actually you'll get the best out of your spend, out of your budgets, and there is some evidence-based supporting the practices that you might implement. So there's been systematic reviews as well, which provide an overview of the research that's already been completed. So the Wellcome Trust, there's a paper by Daniels et al. And others, understanding what works from the evidence base. The interesting thing for me is that these best practice guidelines on mental health, not the health and safety exec, really, because that's been around even longer, have been around since 2012, and the evidence and advice has not really changed, but our call to action has been poor. Why the evidence base is so important is it makes sure that you're getting those best outcomes and you're not focusing necessarily on just individual but systemic change. So if we take into account those best practice guidelines, what is it that we think we should be doing? So this is around where would you start to focus? So you can see here in red are the activities that are legislative, they are required by law. But the evidence base really says that the key critical things for organisations to consider that work are a mental health at work plan. So an action plan that you've put together that's communicated across the organisation and people understand what it is that you as an organisation are hoping to achieve in supporting people with their mental health. Now, we've all heard prevention's better than cure. There is robust evidence to suggest that if you offer employee mental health and wellbeing programs, you will see a financial return from doing so, especially if that spending comes in the form of preventative strategies, which studies have shown offer the biggest returns. So according to Deloitte, the return on investment for mental health interventions was 4 to 1. So on average, for every £1 a company spent, it saved £4.20. This figure was up to 6 to 1 for preventative measures such as awareness and line manager training. And one study published in The Lancet showed as high as a 9 to 1 return on investment on proactive mental health training, and that was within the Australian Fire Service. If you think about individual mental health support and therapy, there's about a 3 to 1 return on investment in comparison. But what we're saying is it's not one size fits all, and you will need a range of different strategies to support your employees. Everybody has different needs, and that's what makes mental health a little bit more tricky and a little bit more difficult to conceptualize, to plan, and to implement. But what we have here is good mental health information, some support that's available, invest in mental health training, manage your mental health and mental health awareness are the critical things. And if you're at your starting point in your journey, these are the things that potentially will be giving you the best outcomes for your spend. If we're thinking about going above and beyond, and we want to provide even more multi-level support because, as I said, that one size doesn't fit all, and to really get the best outcomes and benefits, you really need to treat mental health as a core component that's integrated into everyday systems and processes. So you would want a proactive approach. So you want a plan, and you want to collect mental health data. You want to think about what is your vision for mental health, your objectives, what does that action plan look like, and how are you going to measure the outcomes? What are those metrics going to look like? And you will be wanting to integrate, as I said, into policies and think about mental health charters. I think the other thing that it's really important, so if you think about policies and procedures within your organisation, you know, when I talk about integrating into everyday systems, then we're talking about asking wellbeing questions as part of meetings, as part of your one-to-ones, and really starting to think about it at each point of contact with your employees. To really get the best out of that and to provide opportunities for growth and development. So within the risk assessment, we talked about a risk assessment, and generally people apply that to a role, and then there's the risk register and there's the review process. But taking that further, you could think about individual risk assessments and team and department risk assessments as well, and building on your understanding of mental health, feeding that back into a information system that really helps you to understand the overall mental health of your organisation. And developing the mental health toolkit further, so not just good mental health information, but maybe well-being coaching, thinking about a communication plan, thinking about mental health and well-being events and calendars, and really trying to think about that beyond the sort of standard mental health awareness week, because people have mental health for the whole of the year and the whole of their lives, not just for one day or 1 week, where we concentrate on that. And it's great for it to be used to harness activity and raise awareness, but then what are you going to do beyond that? So mental health training, we talked about awareness and manage your mental health, but also thinking maybe about bespoke sessions that are relevant to your industry. So we've been working with organisations about shift work and how to manage mental health in relation to that. It might be that you have shift workers and sleep is an issue. So we've been developing sleep webinars and best practice with some of our other organisations. For those people who have drivers, thinking about maybe driver health and mental health and well-being and physical health, because they're intrinsically related. So it might be that it's industry or organisational issues. And then really for mental health support, adding in some really critical things around, return to work, maybe well-being plans, or in therapy we call them relapse prevention plans. But as someone comes back to work, having a plan that says, what was it that caused you the problem? What helped you to get better? What would we need to do? How would we know it was happening again? What could we put in place to support you really quickly to prevent you going off and support you in the workplace? And then obviously you've got your standard employee assistance program for all of life's problems. But then, if you're going to go above and beyond, you might want to think about additional psychological therapies that are evidence-based, within NICE guidelines. EAP is for all of life's difficulties, and it's a counselling model. Counselling isn't indicated for all of the, isn't best practice guidelines for all of the range of mental health conditions that your employees might be experiencing. You might want to think about trauma support, and we've been working with some organisations around putting a trauma support package together. We always don't want to have to implement that as a service, but unfortunately sometimes incidents do arise. People either die by suicide, or maybe there's an accident in the workplace, and a trauma support service can help you with that. And then thinking about other mental health support, so mental health first aiders, champions, ambassadors. Organisations have decided how they want to use their terminology to fit with their industries, and there are other things to consider. So this is where you're going above and beyond. I think it's really important to just point out that there is now an ISO standard for psychological health and safety at work. It's an international recognised standard to help you to put a framework around preventing work-related injury. And it's aligned to the ISO 45001 parent standard, which is occupational health and safety. But it can help you to plan and execute a strategy that reduces the stigma around talking about mental health, and it can support in building a positive working environment, improving organisational resilience, creating a positive health and safety culture, which enhances performance and productivity and hopefully reduces absenteeism. Looks really at primary risk factors, where we're going to be assessing them to discover what changes can improve the working environment. And that's a really critical part, because if you don't look at the risk assessment and your working environment and how people are interacting with your working environment and their workloads and their jobs, then implementing services at the other end are really sticking plasters, and they're really important that we do have sticking plasters and bandages and sometimes things such as that, but it's not going to help the organisation move forward in the long term without really focusing on some of those sort of primary areas as well. So then there's the secondary area and tertiary, and you can see there it's around risk management and illness management as well. How do we move beyond awareness and into action? And I think this is a really difficult thing for people to know. So we start to understand that we need to do something about our workforce's mental health, and we need to support individuals and teams and the whole organisation. But actually, it can be a really scary thing, and it can feel really overwhelming. It will cost you more in the long term if you do nothing. But actually, what are the key sort of things that you might want to consider to move from knowing something and into action? And I call that an insight action model. So think about the fact that, you know, it can be about your culture. It doesn't have to be money and money. You can invest time and energy in building a mentally healthy culture that supports employees to thrive and be fit for purpose. So you can think about responsibilities. Make sure everyone knows how they can play their part in contributing to a mentally healthy culture. Think about behaviours. They cost nothing. Adopt helpful and positive behaviours in the workplace that enhance the mental health of staff, and integrate an idea about what behaviours you expect to see within your workforce into your induction, into your training, into your rewards systems. Talked about integration, making mental health a part of an everyday conversation where it can be integrated into those internal systems and processes, you know, one-to-ones, loop this in as a feedback, and then take your sort of feedback, check in on staff on a regular basis, understand their needs and what support they want. And actually, if we can document that and feed it back into a central area, you can then start to think about, you know, what is it our workforce are looking for, what might they be needing, and how can we think about implementing that or accessing that. Education, using educational material to encourage and promote positive behaviour change. Educational material can be available in, in a whole range of sort of guises. So we've worked with organisations where you know, access to systems is really difficult. So, you know, there's boards in the staff room where people can go and get that information. You know, they can click a QR code and that brings up information for them. We've had revolving information on TV screens within particular work locations, as well as, you know, things like the intranet, maybe newsletters and things like that. Confidence. Think about supporting staff to build their own confidence around looking after their own mental health and supporting others to do so. That's really around mental health awareness and also just general healthy behaviours. So the 5 ways to well-being, for instance, thinking about, as I said, sleep and how to positively manage their own health behaviours. And then also thinking about how do they look out for their other staff co-workers, and can, you know, we often gain support from the individuals around us, not necessarily just our managers. We spend a lot of our time at work, so actually you're more likely to see a work colleague than you are potentially to see your spouse, partner, other half, etc. So giving people the confidence to manage themselves and to ask questions and support others, and also think about how they might signpost people as well. So that, I suppose, comes also with managers, but broader staff. If people understand what services are available, can they signpost people to really great information, then that can be really helpful. We're not expecting, and nor should you feel that because you're managing mental health in the workplace that you need to be a counsellor or you need to be incredibly skilled. A lot of it is about common sense and good communication, and genuinely wanting to help people. And then thinking about that long-term approach. So how do we move away from short-term vision towards a long-term approach, supporting mental health? Build on the basics. So we've talked about what the basics would be, and then what might be next, and then where you could go above and beyond. But don't be afraid to pivot. If you find out that something's not working, or actually no one's using it, it's not useful, it's fine. Acknowledge and accept, and look at what you can do next. So I thought it'd be really helpful to think about a case study. So this is a case study from a global leader in food and beverages that I've worked with previously. And when I was working with the organisation, we identified key problems, and that was there were rising incidents of long-term and mental health days lost, long-term mental health, and the days lost to mental health were actually overtaking musculoskeletal, and that was the first time that had happened within the organisation. The EAP was unable to provide the level of support needed to those staff members. So we sat down and we thought about what could the solutions be, and we implemented a work-focused treatment which expedited return to work. So that was above and beyond the EAP. It was gatekept by HROH, and the individuals that were referred in came in for an evidence-based intervention with a capped number of sessions, but there was a very specific focus on return to work. How were the issues impacting somebody's work, and what could we do to reduce that so we could effectively help them to return to work, but also giving advice to OH and line managers about return to work plans and planning and programs. We looked at HR and OH management training in things like crisis management, chronic embitterment, which is a term that I think if we discussed it, you'd all know. So those individuals who have really divorced the organisation, might have experienced something that they feel has compromised their own internal rules in the workplace, quite angry, and it's really difficult to reconcile. And how do we manage those individuals and assess them and see if there's things that we can do, and there are some particular interventions. We rolled out manager mental health training across the organisation. We looked at a bespoke mental health training for specific organisational challenges, and the organisation actually invested in their own mental health first aid trainers, but we supported the rollout and the policy development, so the mental health first aid policy, and then the support for those first aiders so that they were supervised and had a space to talk about the experience of being a mental health first aider, to manage their own thoughts and feelings and safety around that. And what were the outcomes of that? The outcomes were that we saw an increased awareness and ease of reporting mental health conditions. There was a 27% increase in episodes of short-term mental health absence. And before you all gasp and go, oh my God, that's terrible, there was a reduction in other short-term absences, and there was a 26% decrease in the number of days lost to mental health. And what we know was because there was an increased awareness and we reduced the stigma of mental health within the workplace, people were more likely to say this is due to a mental health condition rather than say, I've got a bad back, I'm feeling sick, I've got a stomach bug, I've got flu or whatever. And the other thing that happened was when people were in the treatment programme, employees recovered and were back at work before they could even commence treatment within the NHS. So on average, people were back at work within a 6 to 10 week period, and the assessment may have happened within the NHS, but the waiting list for treatment was months and months in advance. So really great positive outcomes where we could measure impact of the services that we had implemented. I just want to finish almost on another case study now. The reason that I'm looking at this with you is that this was a multinational telecommunications company. But these are the things that were happening within that organisation when I was working with them to develop their mental health services in 2016. And if you look at the things here, they are exactly the same things that actively we've been talking about today. The evidence base, as I said, has not changed. It is just our call to action has been slow on the uptake. So I'm not going to go through each of those, but what I would say is the provision of support was around, they had a newsletter, they had a resilience toolkit and training, they had a mindfulness program, they had well-being plans, and what was called a well-being passport. So when people had been off work, they came back, and that passport was a plan, but it was also when managers moved and changed, they could actually take that plan rather than having to constantly ask for particular supports, etc., with every new manager that came through. They implemented manager mental health training. They had an EAP and an OH service. They had a mental health service that complemented the EAP, and they also had a mental health toolkit and a page dedicated to mental health on their intranet. So this was in 2016. So my question or my ask is that we think about how can we actually move from that place of knowledge into action. I just wanted to let you know that a little bit about guiding principles of resilient minds, just to finish off. You know, we're underpinned by a sound evidence base and teaches people the skills they need to support mental health and stay mentally well. We have 3 key components around our services. We're positive, so we take a positive approach. We focus on prevention and early intervention, and I'm really keen that we promote hope and inspiration. And we're practical, so we create meaningful impact by giving organisations practical strategies and tools to mind their own mental health and support others to do so. And we're proven, so our mental health services and resources are all underpinned by the evidence base, and they're also rooted in clinical practice and learning theory. My final thoughts before we throw it open to questions, please, employers, think about recognising that mental health is a business issue. Provide help and support to managers to understand and deal with it. Don't let cost be a barrier, because most interventions are low key if you know how and you have the right support to implement them. Understand that the economic cost of failure to act is really high. But most of all, do the right thing, because the human cost can be far higher. And if you do want to contact us, then there's contact details there. And our tagline, and John will kill me if we don't get it, is don't let the thought of managing mental health stress you out. So hopefully today's session has given you some information, but some practical sort of advice and some food for thought. And I'll open it up for questions.
Thank you so much, Claire. You might be lightheaded after speaking non-stop for 45 minutes. Give you a break to catch your breath. Thank you. Really, really interesting stuff. And it was great to go through what, you know, businesses are expected and required to do by law, and what good practice looks like, and what better, you know, the best looks like, and some great examples of that too. Thank you so much. I know this recording is going to be a really useful resource to the wholesale sector, so thank you. Are there any questions from the floor? The chat is open there if you do have any. If you have none off the top of your head, but later on this evening one pops into your head, do take down the email address there for Claire and for John, or you can always drop me a line and I can connect you. Wait, if there are any questions. No, it looked like that was such a brilliantly thorough talk, Claire. We've got all the information we need to this point, so thank you very, very much for that. That was fantastic. Really appreciate you coming along and delivering such an insightful piece. Thank you.
You're welcome.
Right, well, I shall draw us to a close. And we shall be circulating this recording out to you later on this week. Many thanks for joining us, and thank you again, Claire and John.
Welcome. Have a good rest of your day, everybody, and thank you for attending.
Thank you. Thank you. Bye-bye.
Thank you, Claire.
Thank you.
Should we can catch up offline if you like.
Yep.